It's 6:47 in the morning. Your alarm hasn't gone off yet, but something woke you up anyway. Not a sound, not pain, not a nightmare, just your mouth. It feels like someone poured sand into it while you were sleeping. Your tongue is stuck to the roof of your mouth. Your lips feel cracked and tight. You reach for water on the nightstand again, and you think to yourself, why does this keep happening to me? Here's what nobody tells you. That moment, that dry, chalky, desperate feeling every single morning, is not just an inconvenience. It is not just part of getting older, and it is absolutely not something you should keep ignoring. That feeling is your body trying to send you a message, a very specific, very urgent message. And in some cases, the cases I'm about to walk you through today, that message is a warning sign for something happening deep inside your body that has nothing to do with your mouth at all. 5 causes. Some of them are simple. Some of them will genuinely shock you. And at least one of them, I can almost guarantee, is going to make you stop, sit up straight, and say, that's me. If you're new here, welcome. This channel exists for one reason only: to give adults over 60 the kind of honest, research-backed, clear-held information that too often gets squeezed into a 7-minute doctor's appointment and never fully explained. We don't do fear here. We don't exaggerate. We connect dots. We follow the science. And we take your symptoms seriously, even the ones that seem minor. Before we go any further, hit subscribe if you haven't already, because next week, I'm covering something that genuinely surprised me when I went through the research. A specific combination of 2 very common supplements that millions of seniors take every single day that may actually be depleting a critical nutrient from their bodies instead of helping them. You will not want to miss that one. But right now, dry mouth. Let's go deep. First, I want to reframe the way you think about saliva, because most people dismiss it, and that dismissal is a mistake. Your body produces between 1 and 1.5 liters of saliva every single day. That is not a small amount, and it's not accidental. Saliva coats your teeth like armor, protecting them from the acids that cause decay. It carries enzymes that begin breaking down your food the moment it enters your mouth, before it ever reaches your stomach. It contains natural antibacterial compounds that actively fight infection in your mouth and throat. It lubricates your tissues, protects your gums, and helps regulate the bacterial environment of your entire digestive system. Saliva is, in many ways, your body's first line of defense. So, when you wake up every morning and that entire defense system has essentially switched itself off overnight, that matters. That is a signal worth paying attention to. Now, here's the finding that changes everything. A landmark study published in the journal Oral Diseases found that among adults over 65, chronic morning dry mouth, what the medical world calls xerostomia, was present in nearly half of all participants. Nearly half. But here's the part buried inside that statistic that almost nobody ever hears. In over 80% of those cases, the dry mouth was not the actual problem. It was a downstream symptom of something else entirely. Think about the difference between a smoke detector and a fire. The smoke detector going off is not the emergency. It's the announcement of one. Morning dry mouth is your body's smoke detector. And today, we're going to figure out which fire it might be pointing to. There are 5 primary causes I want to walk you through. And if you are currently waking up every morning with a dry, uncomfortable mouth, at least one of these is likely your answer. And before we get into it, drop a hello in the comments. Tell me your name. Tell me where you're watching from. I read every single one, and I genuinely love knowing who I'm helping today. The single most common culprit behind morning dry mouth in adults over 60 is one that almost nobody suspects when they first think about this. It's not a disease. It's not a vitamin deficiency. It's not something exotic or rare. It's the medication sitting in your medicine cabinet right now. Here's a number that should genuinely stop you cold. More than 400 commonly prescribed and over-the-counter medications carry dry mouth as a documented side effect. More than 400. We're talking about blood pressure medication, particularly the class called diuretics. We're talking about antihistamines, the allergy pills that millions of older adults take every spring and fall without a second thought. We're talking about antidepressants, overactive bladder medications, certain pain relievers, and even some over-the-counter sleep aids that seem completely harmless on a label. Now here's the piece that most people, and honestly, even some doctors, completely miss. When you're taking multiple of these medications at once, the dry mouth effect doesn't just add up. Research published in the journal Gerontology found that the effect compounds significantly when medications are combined. Seniors taking 5 or more daily medications showed nearly twice the rate of significant dry mouth compared to those taking 2 or fewer. And the average American over 65 takes between 4 and 5 daily prescriptions, plus supplements. I had a patient I'll call Gerald, 71 years old, retired, meticulous about his health. He'd been dealing with severe morning dry mouth for almost 2 years. He'd seen his dentist 3 times about cavities that seemed to keep appearing from nowhere. He was using every oral rinse on the shelf. Nothing helped. When he came to see me, I asked him to do something simple. Bring every single bottle from his medicine cabinet. We lined them up on the table. 6 prescriptions, 3 supplements, 2 over-the-counter products he used regularly. Within that lineup, I found 4 separate items that are known to reduce saliva production. Not 1, 4, working together every single night. We worked with his prescribing physician to adjust the timing of just 2 of those medications, not the dosage, just when during the day he took them. Within 3 weeks, Gerald told me his morning dry mouth had dropped from a 9 out of 10 to a 3 out of 10. No new prescription, no procedure, just connecting the dots. Here's your action step for this cause. Write down every single medication and supplement you take, including melatonin, ibuprofen, antihistamines, and any vitamin or herbal product. Bring that physical list, not your memory, the actual list, to your next appointment and ask your pharmacist specifically, could the combination of anything on this list be affecting my saliva production? Pharmacists are extraordinarily knowledgeable about interactions and side effects, and this conversation is completely free. Pay close attention here, because this second cause affects tens of millions of Americans, and research consistently shows that the majority of people who have it have absolutely no idea. We're talking about obstructive sleep apnea. Here's the simple version of what happens. When sleep apnea occurs, the soft tissue at the back of your throat collapses partially or fully while you're asleep. Your airway gets blocked. Your brain sends an emergency signal. Your body jolts, gasps, or shifts just enough to reopen the airway, and then you fall back to sleep. Most people never consciously wake up during these episodes. They have no memory of it in the morning. But here's the connection to dry mouth that almost nobody makes. When your airway is blocked and you can't breathe through your nose, your body does what must. It breathes through your mouth, and mouth breathing across an entire night evaporates saliva at a rate that nasal breathing simply doesn't. You wake up feeling like your mouth hosted a wind tunnel for 8 hours. But the dry mouth is, again, the least of your concerns here. Research from the American Heart Association has found that untreated sleep apnea in adults over 60 significantly elevates the risk of stroke, irregular heart rhythms, and serious cardiovascular events. A separate analysis published in the Journal of Clinical Sleep Medicine found that seniors with undiagnosed moderate to severe sleep apnea had measurably higher rates of cognitive decline over a 5-year follow-up period. So if your body is waking you up with a dry mouth every morning, and the underlying cause turns out to be sleep apnea, that dry mouth isn't the story. It's the table of contents. Ask yourself these questions honestly. Do you snore? Have you ever been told your breathing sounds strange or stops during sleep? Do you wake up exhausted even after a full night in bed? Do you get unexplained headaches in the morning? Do you find yourself falling asleep in chairs, waiting rooms, during quiet afternoon moments when you really shouldn't be that tired? Any combination of those symptoms, alongside morning dry mouth, should absolutely prompt a conversation with your doctor about a sleep study. And here's the good news. Modern home sleep studies are done with a small device you wear on your wrist and fingertip. No hospital, no wires, no overnight clinic stay. Many Medicare plans cover this fully. One phone call is all it takes to find out. If you're still with me and this is making sense, type the number 2 in the comments. It helps me know you're engaged and getting value from this. Let's talk about blood sugar. And specifically, let's talk about the people who have a serious problem with their blood sugar and don't know it yet. According to the CDC, approximately 38 million Americans currently have diabetes. And here's the part that every senior needs to hear. Nearly 1 in 4 of them has not been diagnosed yet. That means millions of people right now are walking around with elevated blood sugar levels, causing real, measurable damage to their bodies without a single entry on their medical chart. Here's a connection between elevated blood sugar and dry mouth. When blood glucose is consistently high, your kidneys go into overdrive trying to filter and flush out the excess sugar. To do that efficiently, they pull fluid from other tissues throughout your body. This creates a kind of slow, systemic dehydration that doesn't always announce itself loudly. And one of the most noticeable places that dehydration shows up is in saliva production. An NIH-backed analysis found that among people with poorly managed type 2 diabetes, persistent dry mouth was one of the most commonly reported daily symptoms. And in many cases, the dry mouth had been present for a year or more before the diabetes diagnosis was ever made. Your mouth was warning you. Nobody connected the dots. I want to be direct with you here. If your morning dry mouth comes alongside any of these other signs, urinating more frequently than usual, especially at night, fatigue that doesn't improve with rest, cuts or wounds that seem to take longer to heal than they used to, or vision that seems occasionally blurry in a new way, do not wait for your next routine physical. Call your doctor this week and ask for a fasting glucose test and an HbA1c. The HbA1c gives your doctor a 3-month average picture of your blood sugar level. It takes less than 5 minutes to draw. It can catch something your dry mouth may have been quietly announcing for months. This fourth cause surprises people because of how simple it sounds. But the biology underneath it is both fascinating and genuinely important for anyone over 60 to understand. Chronic dehydration. Now, before you say, I drink plenty of water, stay with me, because hydration in adults over 65 works very differently than it did when you were in your 40s. Here's what happens as we age. The hypothalamus, the part of your brain responsible for generating thirst signals, becomes progressively less sensitive. A study published in the Journal of Physiology demonstrated that older adults can reach fluid deficits of 2% or more of their body weight without experiencing any meaningful sensation of thirst. In plain terms, your body can be genuinely running low on water, and it simply won't tell you the way it used to. At the same time, your kidneys become less efficient at conserving water. Your skin loses moisture more readily. And if you're taking diuretics for blood pressure, which we already discussed, you're losing even more fluid than your peers who aren't. The result is a quiet epidemic. A large portion of older adults are gently dehydrated through most of every day. And the only outward sign they notice is that sticky, dry, uncomfortable mouth every single morning when they wake up. The fix here is one of the most straightforward on this entire list. Stop waiting to feel thirsty. That signal is no longer reliable for your body. Instead, build hydration into your daily routine the same way you take your medications, by the clock, not by sensation. Aim for a minimum of 6 to 8 glasses of water distributed across your waking hours. Set reminders on your phone or keep a water bottle in every room you regularly spend time in. And take note, caffeinated beverages and alcohol do not count toward your total. They actively accelerate fluid loss. If this opened your eyes, share this video with someone over 60 who keeps waking up with a dry mouth and thinks it's just a normal part of aging. Most people have no idea their thirst mechanism has changed. And a simple like on this video helps us reach more people before dehydration quietly becomes something more serious. The fifth cause generates more undiagnosed cases in almost any condition I discuss on this entire channel. And if you are a woman over 55 watching right now, I want you to pay especially close attention to this one. Sjogren's syndrome, spelled xerostomia, is an autoimmune condition in which your own immune system mistakenly attacks the glands responsible for producing moisture in your body. Specifically, the salivary glands that keep your mouth wet, and the lacrimal glands, which produce your tears. The result is a body that progressively loses its ability to keep itself lubricated. The mouth becomes persistently dry. The eyes become dry, gritty, and irritated. Joints begin to ache. Fatigue sets in, not ordinary tiredness, but heavy, disproportionate exhaustion that doesn't match what you're actually doing. Here's why this condition belongs on this list. 90% of Sjogren's diagnoses occur in women. The average age of diagnosis is the late 50s to early 60s. And studies published by the Sjogren's Foundation estimate that it takes the average patient between 2.5 and nearly 5 years from the time symptoms begin to receive a correct diagnosis. Why? Because the primary symptoms are routinely dismissed as normal aging. Dry mouth? Oh, that's just getting older. Dry eyes? Try some drops. Fatigue? Well, you're not 30 anymore. If any of those phrases sound familiar, if your morning dry mouth consistently comes paired with dry, irritated eyes, joint pain without a clear explanation, or fatigue that seems wildly out of proportion to your daily activity, please bring up Sjogren's syndrome by name at your next appointment. A straightforward blood test can screen for it, and knowing about it changes how it's managed completely. Let's bring everything together into something you can actually begin today. Step 1. Conduct your medication review. List every prescription, every supplement, every over-the-counter product you use regularly. Bring the physical list, not your memory, to your pharmacist or physician. Ask specifically about the combined impact on saliva production. One conversation can reveal more than years of guessing. Step 2. Assess your sleep honestly. For 1 week, track 3 things each morning. Whether your mouth was open or closed when you woke up, whether you feel genuinely rested or still exhausted. And if you have a sleeping partner, ask them to notice any loud snoring or pauses in your breathing. If a pattern emerges, ask your doctor for a sleep study referral. Most are now done at home and covered by major insurance plans. Step 3. Don't skip the blood sugar test. If you haven't had a fasting glucose and HbA1c run in the past 12 months, schedule it this week. This is especially important if you have any of the accompanying symptoms I mentioned alongside the dry mouth. Step 4. Restructure your hydration. 8 glasses minimum. Spread throughout the day, by schedule rather than by thirst. Track it for 2 weeks. Your body will respond faster than you might expect. Step 5. Get nighttime relief while you investigate the root cause. Look for oral rinses or gels containing xylitol, products like Biotin Dry Mouth Oral Rinse or ACT Dry Mouth Rinse. Use them immediately before sleep each night. And critically, avoid any mouthwash containing alcohol. It will make the dryness significantly worse. Xylitol-based products do 2 things at once. They moisturize, and they protect your teeth from the bacterial overgrowth that dry mouth actively enables. One important note. If you are currently on blood thinners, lithium, or ACE inhibitors, speak with your doctor before making significant changes to your daily fluid intake. Hydration levels affect how those medications behave in your body, and your doctor will want to be part of that decision. And one urgent note. If your dry mouth comes alongside difficulty swallowing, pain when eating, white patches anywhere inside your mouth, or unexplained weight loss, please do not wait for a routine appointment. See your physician promptly. These combinations together warrant immediate evaluation. Here is what I want you to carry with you from everything we've covered today. Morning dry mouth is common, but common is not the same as normal, and it is absolutely not the same as harmless. Whether it's your medications interacting in ways nobody told you about, a sleep condition that's been quietly working against your heart and your brain while you sleep, blood sugar that has been creeping upward without loud enough symptoms to catch your attention, or an autoimmune condition that has been dismissed again and again as simply getting older. Every single one of those things can be identified. Every single one of them can be addressed. You came here with a symptom. You're leaving with a map. Now I want to hear from you. Drop one word in the comments. Type sleep if you suspect nighttime breathing may be your answer. Type meds if you're going to have the medication conversation with your doctor or pharmacist. Type testing if you're booking a blood sugar test this week. I read every single comment, and what you shared genuinely shapes what I cover next. If this gave you something that your last doctor's appointment didn't, please subscribe, because next week I'm pulling back the curtain on a warning sign that a very common cholesterol medication may be doing more harm than good in certain adults over 60. It's one of the most frequently asked questions I receive, and it deserves a thorough, honest answer.